Starting a family can be very exciting, and getting pregnant is the first step thereof. To ensure a healthy and happy pregnancy, you need to make some changes to your lifestyle and diet in order to prepare your body for conception and pregnancy. Here are some helpful tips to get you underway. Remember to hit that like button and also subscribe. 1. Eat a healthful, pre-pregnancy diet. Diet and lifestyle choices can have a significant impact on your fertility. Eating well and developing healthy habits are important before and during pregnancy. Studies show that women who adhere to a combination of 5 or more lifestyle factors, including specific changes to their diets, are at a 69% lower risk of ovulatory disorder infertility. This video will help you lead a good lifestyle and give you a good pre-pregnancy diet. Increase the amount of good fats in your diet. Monounsaturated fats are often known as good fats. Eat more avocados, nuts, and seeds, and use olive oil and canola oil for cooking and in salad dressings. Limit foods containing trans fats. Examples of these types of foods include vegetable shortenings, margarine, bread food, pastries, frostings, and fried foods. You can also check the ingredients list for hydrogenated or partially hydrogenated vegetable oil. Choose low GI and GL carbohydrates. This includes dried beans, legumes, fresh fruits, 100% whole grain breads, oatmeal, quinoa, and non-starchy vegetables. The GI measures how much and how quickly a carbohydrate-containing food increases blood sugar and insulin levels. Food is ranked on a scale of 1 to 100. In general, eating food that have a low GI, less than 55, results in a slower rise in blood sugar levels and less insulin secretion. GI alone cannot tell the entire story. The GL also needs to be considered to get an accurate understanding of food's total effect on blood sugar. In general, limit processed carbohydrates such as white rice, bread, and pasta, and most crackers, chips, cookies, and other packaged foods. This is beneficial for any woman trying to conceive, and especially important if you have PCOS, polycystic ovarian syndrome. Eat more vegetarian sources of iron. Vegetarian sources of iron include spinach, beans, legumes, prunes, and cashews. Choose full-fat dairy. Examples include whole milk, full-fat yogurt, or cheese. Women who ate full-fat dairy at least once a day decreased their risk of ovulatory infertility by 27% compared to those who rarely ate full-fat dairy. Source: Women's Health. 2. Achieve or maintain a healthy body weight. Being overweight or underweight stresses the body. This disturbs hormone production, interrupts normal menstrual cycles, and impairs ovulation and fertility. Research indicates that if you are overweight or obese, it will take you longer to conceive, and you are at a higher risk of miscarriage than normal weight women. Losing weight before pregnancy may improve fertility and reduce the risk of pregnancy complications such as preterm birth, gestational diabetes, high blood pressure during pregnancy, and certain birth defects. Also, fertility treatment is generally more successful in women who are not obese. The best weight range for fertility seems to be a BMI of 20 to 24. 3. Be active. Physical activity is best while trying to get fit for pregnancy. If you are overweight or obese, studies show that adding any physical activity improves your chances of conceiving. Regular physical activity increases metabolism and optimizes your reproductive system. Exercise stimulates the endocrine glands, which release hormones that help egg production and maturation. Exercise also decreases stress, an added benefit for fertility. If you are underweight or normal weight, too much vigorous activity may increase the time it takes you to conceive. In one study, when women switched from vigorous to moderate activity, their fertility improved. For some women, more than an hour of vigorous exercise a day can lead to a decrease in the production of the hormones that stimulate ovarian function. This affects egg production, fertility, and the risk of miscarriage. Too much or too little exercise can be detrimental to fertility and a healthy pregnancy. The goal is to find the right balance to optimize your reproductive function. In general, 30 to 60 minutes of moderate exercise is recommended on most days of the week. 4. Take a high-quality preconception prenatal vitamin. Start taking preconception prenatal vitamin as soon as you start trying to conceive. Preconception vitamins provide a complete range of nutrients including folate, choline, iodine, iron, and vitamin D. Consider other preconception supplements. Depending on your age and health history, taking certain nutrients in addition to your prenatal may improve egg quality, help you conceive and become fit for pregnancy. Coenzyme Q10 (CoQ10). If you are over 35, you may want to consider taking a CoQ10. CoQ10 plays a crucial role in energy production in the body's cells, including egg cells. As you age, your cells make less CoQ10 and are less efficient at producing energy. This can lead to poorer fertilization and early miscarriage. A decrease in egg quality is the most important factor affecting fertility with increasing age. Research indicates that taking a CoQ10 supplement can improve egg quality and potentially increase your chances for a healthy baby. Vitamin D3. Vitamin D is a fat-soluble vitamin produced in our skin cells in response to sun exposure. If you are in the sun enough, at the right time of year, you will make all the vitamin D you need. Most of us don't get enough sun exposure to maintain adequate levels of vitamin D. Our diets don't provide enough vitamin D either. Few foods naturally contain much vitamin D. Getting enough vitamin D to achieve an optimal vitamin D blood level is important before and during pregnancy. Several studies have linked vitamin D blood levels of 30 nanograms per milliliter or higher with better pregnancy rates. It is important to have your vitamin D level checked when you start trying to conceive. If your vitamin D level is low, below 30 nanograms per milliliter, take 2000 to 4000 U of vitamin D3 for a few months to restore you to a normal level. Once your level is normal, take 2000 U of vitamin D3 per day to keep you in the normal range. Low vitamin D levels have been linked to pregnancy complications such as gestational diabetes, high blood sugar, preeclampsia, pregnancy-induced high blood pressure, and bacterial vaginitis, bacterial overgrowth in the vagina. Typical prenatal vitamins provide only 400–1000 U of vitamin D, which is not enough for most women. Higher doses, 2000 to 4000 U, of vitamin D3 per day are safe during pregnancy and are effective in achieving normal vitamin D levels. Inositol. Inositol is a B vitamin-like nutrient naturally found in whole grains, beans, nuts, and fruits. You can also find inositol powder as a dietary supplement. Inositol is particularly important for women with PCOS, polycystic ovarian syndrome. Studies show that inositol decreases insulin levels and helps reduce insulin resistance. It also improves hormone levels and promotes regular menstrual cycles and ovulation in women with PCOS. Because inositol also promotes egg quality, it can be helpful while trying to become pregnant. Studies indicate that inositol benefits women going through IVF, in vitro fertilization, improving their response to ovarian-stimulating drugs used during this fertility treatment. There are many different forms of inositol. The two types that have shown benefit are myo-inositol and D-chiro-inositol. Recent studies have shown that taking a combination of these two forms, in the body's naturally occurring ratio of 40:1, is more helpful than taking either form alone. The recommended dose of inositol is 2000 mg of myo-inositol plus 50 mg of D-chiro-inositol, twice a day. It takes at least 3 months of consistent use to see results from inositol. Source: Women's Health. 6. Limit caffeine and alcohol. Both caffeine and alcohol may reduce your fertility. Caffeine. Caffeine is a well-known stimulant found in coffee, tea, chocolate, soda, and energy drinks. Most women know that limiting caffeine is important during pregnancy, but what about before getting pregnant? Can having your daily coffee affect your chances of conceiving? The answer is yes, but it depends on how much caffeine you're consuming. Studies show that as little as 200 mg of caffeine daily can decrease your chance of conception and increase your risk of miscarriage. Other studies have shown that caffeine lengthens the time it takes to get pregnant. Alcohol. Although the research is mixed, drinking alcohol may delay the amount of time it takes to get pregnant. A study showed that women going through IVF who drank more than 6 drinks per week were 18% less likely to get pregnant. The bottom line is to decrease the amount of alcohol you drink while trying to conceive. This is especially important if you are going through fertility treatment. If you might be pregnant, do not drink. 7. Stop smoking. If you smoke, stop before you start trying to conceive. Smoking is not only harmful to your health, but it is also harmful to your fertility. Smoking cigarettes increases the time it takes to get pregnant. If you get pregnant, smoking increases the risk of miscarriage and birth defects. 8. Reduce stress. We don't know for sure whether stress causes infertility, but we are aware that infertility causes stress. The connection between stress and fertility isn't entirely clear. Studies indicate that pregnancy is more likely to occur during months when couples report feeling more relaxed, and less likely during months they report more anxiety. Practicing stress management techniques helps some women get pregnant who were not successful before. Acupuncture, massage therapy, exercise, meditation, and deep breathing techniques show promise in decreasing stress. 9. Get enough rest. Adequate rest is important for your health, your fertility, and for a healthy pregnancy. During sleep, our bodies go into repair and restore mode. Getting enough shut-eye is necessary for repairing cells, regulating hormones, and many other body processes. Sleep is important for the regulation of hormones involved in ovulation and reproduction: leptin, progesterone, estrogen, luteinizing hormone, and follicle-stimulating hormone. Sleep deprivation can disrupt your hormonal balance, resulting in irregular menstruation and ovulation. This may mean it takes you longer to conceive. Aim to sleep 7 to 9 hours per night, most nights of the week. 10. Seek medical care for untreated conditions. Certain medical conditions have a negative impact on fertility and pregnancy. It is important to see a gynecologist or primary care physician for a physical before trying to conceive or starting fertility treatments. Getting treatment for a previously undiagnosed condition can improve your fertility and help you get fit for pregnancy. In summary, eat a healthful pre-pregnancy diet, exercise moderately, take the right supplements, and make other lifestyle changes to allow your body enough time to rest and eat well. Don't miss a video. Hit subscribe.